Hello friends, welcome to Cortex YouTube channel. Today I have come with the clinical question. Let's solve it together. So question goes like this: 58-year-old male complains of chest pain 30 minutes. Crushing type, it radiates to left arm and jaw, not relieved by nitroglycerin. The ECG was done and which shows ST depression in 2-3 AVF, lead 2-3 AVF, that is inferior leads, and serial cardiac markers, serial measurement of cardiac biomarkers like your troponins were normal. So what is the diagnosis? Let's look at the options. Option A is unstable angina, option B is stable angina, option C is acute myocardial infarction, and option D is pericarditis. If you know the definition of all these options, you will easily pick up. And let's first solve this question by ruling out method. So as we all know, acute MI, when we talk about acute MI, we usually talk in terms of STEMI or ST elevation. So in acute MI, obviously it can be non-STEMI also. Okay, let's look at it. Let us keep it that way only. Pericarditis. Let's come to the option D, pericarditis. Pericarditis, here as we know, one of the cause for ST elevation is pericarditis. So as we see, ST elevation, that is global ST elevation, that means all the 12 leads will show ST elevation in pericarditis. That's why the option D is ruled out, because question mentions ST depression. Okay, now we are left with these options. As we know, the stable angina, pain subsides by rest or nitroglycerin, sublingual nitroglycerin. But here the pain is not relieved by the nitroglycerin. So option B is also ruled out. Now, unstable angina, we are left with unstable angina and acute MI. See, one thing, everyone will know this: acute MI means myocardial infarction means death has happened, so biomarkers will be elevated, but here the biomarkers are normal, so obviously option C is also ruled out. So we are left with unstable angina, so that's the answer. So this is by ruling out method, and if you know the definition, you can easily diagnose this condition. Let's look at this. Whenever patient comes with chest pain, when I said chest pain, it is typical pain in cardiac cases. So you do ECG. You can diagnose two things. Either it can be ST elevation MI, or it can be non-ST elevation acute coronary syndrome. Okay. So in non-ST elevation acute coronary syndrome, we have two entities. One is unstable angina and one is non-ST elevation MI. So whenever there is word infarction comes, there is myocardial necrosis. So necrosis is present here in STEMI. Necrosis is present in non-STEMI also, but in unstable angina, no necrosis. So where there is necrosis, there is elevation of cardiac biomarkers, that is your cardiac troponins are elevated, but here it is absent. Okay, so this is how you diagnose a case of unstable angina, non-STEMI and STEMI. In STEMI, there will be ST elevation. Obviously, the word only contains ST elevation. Okay. Yeah, hope this information was useful to you. If so, please like, share and subscribe. Thank you.